Hello and welcome to RBJC.com. This segment deals with all the people that are involved when an athlete gets hurt, and we'll take them in some kind of an order. Obviously you have the injured athlete, you have the parents, grandparents, the person that's responsible for that child, you have the physicians, be it the emergency room physician or one of our fine physicians here at Richmond Bone and Joint Clinic. You have the aftercare, you have the EMS, the paramedics who's ever involved, the first aid provider, the physical therapist if there's a need for a physical therapy follow-up. And what we'd like to do is kind of discuss the whole package, the whole total athletic health care group. Let's start with the parents. Hopefully you're in a position where you're able to have health insurance for your child or your daughter or son. They're involved in athletics, and it doesn't really matter what level of athletics they're involved in. If they have health care insurance, then obviously they're able to seek treatment in terms of an injury. Unfortunately, not everyone has that. There are other avenues, and we'll discuss those at a later segment. We want to talk about the role that people play in these particular instances. The athlete themselves, if they've been hurt, usually what happens is if they're asked questions such as, can you tell us what happened? Has it happened to you before? Does it hurt? What level does it hurt from 1 to 10, with 1 being it doesn't really bother me, number 10 means excruciating pain. This is what the athlete provides. They provide the feedback. Sometimes they're able to tell you exactly what happened. I planted my knee, I turned, I felt a pop, it hurt, it hurts. Sometimes it's something, a visual thing they can tell you about. Well, look, my ankle, my knee is swollen, my hand hurts, my thumb hurts when I bring it in this way. Those are the things you look for in terms of providing initial care for that athlete. Number 2, the parents, how they respond. I mean this in all sincerity. We ask the parents never to panic. I can assure you those people that are trained to assist athletes, such as athletic trainers, the physicians, EMT, paramedics, they're not there to injure your child, I can assure you that. So if you allow them the opportunity to perform their job, they'll do the things that we're going to mention here in just a second. But if you can be there, ask questions, you're the parent, obviously we'd like you to be the adult in the situation, but ask any questions that you need to ask. You know, what do you think it is? What do you think we should do? What are our options? We can talk about an athletic trainer. Licensed athletic trainers in the state of Texas, the whole profession is so wonderful. Many of these people are hired at a high school. They provide health care for 7th graders through 12th graders, male, female, all sports. They perform rehab on their campus. They perform initial injury assessments. They're a great assistance to the athlete when they're hurt. So those folks are well established in what they do. They have protocols that they follow in terms of triaging the athlete and then referring them on to the parent and or emergency room or physicians such as we have here. The physicians themselves, we are an orthopedic practice, so obviously we deal with bone and joint injuries, well versed in it. Several of our doctors are team physicians for local area high schools, so they have that kind of nuance, that kind of vision they have with the kids. They're there, they get hurt in a football game, they're able to see them quickly. So they're also another part of that. And sometimes you bring your child into the clinic, perhaps for a new injury that they fell at home or something. You bring them in and they're able to assist you here just as well as they would out on the field. Paramedics, EMS, wonderful people. Is a very difficult profession. You know, they never see the good in everything. They always see an accident. They always see people in pain. Let them do their job. You know, a lot of times they'll ask, where would you like to transport the child? You know, they're going to make that athlete safe before they transport. But always ask questions. You have that right as a parent and as a patient. You have the right to answer whatever questions that you ask and the options that you want, where to be taken to, and what doctors to be seen after that. We can also include coaches and school nurses as part of that, that health care provider package that we mentioned at the start of the segment. Those people are involved in the care for your athlete too, be it if they just follow up with something in terms of a doctor's note to pass on to the teachers in the hall, allow that child to dismiss from class early, or be it just a note that they're passing on to the coach if there is no athletic trainer on campus to make sure that that child is doing what they need to do to do rehab to get back from their injury. Well, I hope we covered most of the things for you in that health care provider package there. Let's kind of go over the parents, the athlete, athletic trainers if there is an athletic trainer on campus, physicians, be it the ER physician or physicians at a clinic like Richmond Bone and Joint, the coaches on campus and the school nurse, All those people play a vital part in taking care of an injured athlete. On behalf of Rich and Bone Joint Clinic, take care and hope to see you soon. Thank you.